think about the circumstances that faces African population and the country and the continent as a whole, is that if you don't know when vaccines are arriving, if you don't know where you're supposed to get vaccinated, if information isn't available in your language, if you don't trust your government, if you historically had limited access to quality healthcare, the vaccine hesitancy is not just Africans are questioning, or it's not just an ignorance thing. It's a question of trust, access, history, and institution. So Africa's COVID experience, it has to be examined from both sides, right? Did the government communicate properly, or did African populations have legitimate reasons to question the information they were receiving? These are difficult questions, of course, but we need to ask them. Just as what is going on in the US is happening, Africa needs to be asking these questions. Also, who controls the science is another major thing that African countries have to look into post-COVID. Imagine you're a health minister in an African country during the pandemic. You receive guidance from the World Health Organization. You receive information from the US, information from Europe, information from China, even information from India. You have pharmaceutical companies trying to sell you products, and then you have your own population asking questions. What should we believe, or what should they believe, right? In this situation, what do? If your country, the country doesn't have strong scientific institutions, labs, research, and all that stuff, you're going to be dependent on somebody else's information, analysis, medicine, drugs, etc., etc. And that's dangerous, right? And again, the thing is that I'm not trying to say African countries should ignore like World Health Organization and stuff like that. I'm arguing the opposite. Africa should have enough scientific capacity to engage with the WHO as an equal partner. Africa is too big, it's too rich for all this nonsense. For dependence. Africa needs to engage with these countries. That is where Africa should be, right? Africa should have enough scientific capacity to engage with the World Health Organization. African scientists should be able to look at data and say, this recommendation is good for us, or this recommendation is not good for us. It should be able to say, contextually, this is what we should do, this is what we shouldn't do. It should not be, oh yes, bring and begging. That shouldn't be the case. And Africa needs to also be able to manufacture its own medicines, right? Because it's not just, and we know that, yes, you can tell me that, oh, we've been talking about this for such a long time, which is true, but we have to keep saying it. And we have to involve the medical practitioners in diaspora and or whatnot, because this is a serious issue here. So Africa needs to manufacture its own medicine because it creates a lot of things: scientific expertise, jobs, research capacity, supply chain resilience, technology transfer, intellectual capacity, emergency preparedness, like COVID. So let me give you a scenario here. Imagine in Africa, for example, where Nigeria, South Africa, Kenya, Ghana, Senegal, Rwanda, and other countries, just to name a few, have strong pharmaceutical and biotechnological labs or industries. Imagine where the universities cooperate with pharmaceutical companies in Africa. Imagine African governments maintaining strategic medical reserves. It changes the question. Africa goes from being primarily a consumer of medical technology and becoming a producer itself, which is important. This was the case in South Africa. If you remember, during COVID, Myrna, which is mRNA, they had a hub in Cape Town, right? And the goal was to help with the hub. I believe the goal at that time was to help build the technical capacity necessary for countries to develop and manufacture its own mRNA vaccines. That was the goal at that time, which was reported. Now, this initiative is fine, right? But the challenge is always technology transfer cannot only be simply meaning building like a hub, which they did, and then the problem is solved. No, Africa needs to have an ecosystem. It's important to have an ecosystem, right? What is an ecosystem and what does it look like? It means having universities, research institutions, pharmaceutical companies, manufacturing facilities, investment capital, clinical trial infrastructure, and skilled workers. That's what it means, right? And all this leads to what? Health sovereignty. But again, health sovereignty doesn't mean isolation. And I want to make that clear, right? Health sovereignty doesn't mean because some people think that when you say African health sovereignty, it means that Africa shouldn't cooperate with other people. No, it's actually the opposite, because no country can do anything by itself, right? So the United States cooperates with other countries, Europe does, China does, and Africa needs to do the same, right? The difference between the two is that partnership is different from dependence. So if you're dependent, like Africa is, which was showed by COVID, you have limited choices. If you're capable, you can negotiate. Africa should be able to say, we want to work with you to anybody in the world, but we also have our own scientists. We have our own manufacturers and our own researchers and our own institutions. And that should be the anchor for any final say. And that's a much stronger negotiation position. That is what Africa should seek for. And also, I talked about trust earlier on, because trust is a public health asset. Trust takes a long time to be built, but it takes a second to be destroyed. So there needs to be clear communication and there needs to be trust. Public health institutions must be transparent enough for citizens so that citizens can understand and know what's happening. That wasn't really prevalent, and that's one of the issues arising now. Okay, so in order to do everything I'm talking about, being health sovereignty and all that stuff, Africa needs better health data as well. And we don't talk about this enough. So you cannot make good public health decisions without good health data. Africa needs stronger systems for genomic sequencing, for example, which is not there, disease surveillance, vaccine monitoring, hospital capacity, and a lot more. Why is this important? Because if a new virus appears, if a new pandemic appears, say in Lagos, in Johannesburg, in Nairobi, in Accra, in any other African country, African governments need to know quickly what is happening, how quickly it's happening, how quickly it's spreading, what is causing it, what are the vulnerability circumstances, the vaccines that are working, the vaccines that are not working, and the side effects. And African scientists needs to be able to, that's why there needs to be development of scientists within the continent, right?